Joining us on the program now, political commentator and director of the Integrity Institute, Dr Bryce Edwards. Bryce, kia ora.
Morena, Andrew.
On the surface, it does look like good news. Another medical school, that means more doctors can be trained in New Zealand. Nothing to see here, but scratch and sniff a little bit, actually. There's been some deals done to get this one across the line.
Oh, look, Andrew, the health system is in a bad shape at the moment. That was a big issue on which the current government was elected.
Yep.
I think across the country, people are concerned, and it's been a growing problem in lots of different areas of the health system, but the availability of health professionals, doctors in particular, is a big one. New Zealand is short, by some estimates, of about 3,000 or getting close up to 3,000 doctors. That's GPs, surgeons across the system.
And those that we do have are dangerously close to retirement as well.
Exactly.
So we can see a bigger problem not too far away from now.
Yeah, so there is a problem that we don't train enough. A lot of the doctors that we do train go overseas. New Zealand has to try and then recruit doctors from elsewhere in the world. It's a very expensive business. We do have those two medical schools in the North and South Islands. They don't produce enough. So the government's come up with, in fact, National went to the election in 2023 saying that they would build a new medical school to produce more doctors, and they would do this at Waikato University. This had actually been something that Waikato University itself had been advocating for quite strongly for a number of years.
Yeah.
And they'd long been keen to join the game and become a bigger player in this area. And so the Vice-Chancellor, Neil Quigley, had put a lot of effort into this, and he'd actually hired a number of lobbying firms to help in the political sphere.
This is where it gets a little bit sticky, actually, because Stephen Joyce, who, of course, was the super minister for a previous national government and continues to be a significant influence on the current national government. He was a key lobbyist for the University of Waikato. He also, of course, had influence with the National Party when it became one of their election policies, correct?
That's exactly what happened. And so Joyce has a small lobbying company, and he got a contract with the university for doing various things, but in particular to advocate with the politicians for this policy. So he was paid over $1 million over a few years for that. And he was very successful in getting the National Party to adopt this policy of building a medical school at Waikato. And there was some leaked correspondence quite early on with Neil Quigley, the Vice-Chancellor, telling National, if you take on this policy, basically it will be a great election sort of gift to you for your second term, having created this in your first term. And when National launched the policy back before the election, the university even contributed, I think it was $5,000 to the campaign launch, or the policy launch, I should say. So it was quite cozy, and that's what I think raises some questions about the whole process of where we've come to on this, and whether this is actually a health decision or a kind of, political decision, if you like.
And a victory for the lobbyists, particularly Stephen Joyce in this regard, who no doubt has got a large bonus this week, although that's speculative. That's not a statement of fact. Having said that, though, there's nothing against lobbying. It's not illegal, and hey, we do need to train more doctors. I know that this has not gone as smoothly as perhaps Waikato University wanted it to. There has been a bit of filibuster from the coalition partners. And David Seymour was saying, hey, look how much money you've saved. Waikato University needed to make a higher percentage contribution in the end.
Yes, so ACT and David Seymour have always been suspicious of this policy, and Seymour's been pushing to have more cost-benefit analysis done on this to see if it actually adds up. And he didn't think it did, at least initially, and neither did the other universities, Otago and Auckland, who currently have the med schools. Arguably, you could say that they had a kind of vested interest in not wanting Waikato to join the competition, if you like. But their argument, which was actually backed up by a lot of other analysts, was that they could be expanded much more cheaply. they could provide a lot more medical graduates, and it was just a case of whether the government wanted to resource Auckland and Otago to expand. And the figures I saw that it would have costed something like 1.1 billion for Auckland and Otago to expand over the next decade or
Yep.
so, whereas this plan overall is going to cost nearly $2 billion. So
Although
this plan at Waikato.
to be fair though, Waikato is investing quite a lot of money into this one as well, and because
Yeah.
of the ACT Party running interference on this, the percentage of that is slightly higher. So something has happened there. Although at the end of the day, Bryce, it still looks like we could have trained doctors cheaper if we had expanded Auckland and Otago. But then again, Stephen Joyce wouldn't have got a payout, right?
I think that's correct. And all the analysis I've seen shows that if you're doing this purely on an economic model, what was best for the taxpayer, you would have just expanded Auckland and Otago. And that was David Seymour's point, I think, as well. Essentially, he pushed them to downsize in the end how much this was going to cost the government. So what we're talking about here are the figures of how much to construct, the buildings, etc.
Yep.
And so I think it was going to cost over 300 million initially, and most of that was going to come from the taxpayer,
Yep.
from the government. He's negotiated that the government, central government, would only really pay about $83 million for the construction of this new med school, and the University of Waikato would pay the rest, about 150 million. So where that money comes from, we're not too sure. I mean, a lot of the university's funding is already from the taxpayer. It's just from a different budget, if you like.
Yeah.
But they say they're also going to raise money from donations, and they'll a lot of it will come from philanthropy. But so somehow they've managed to downsize the size of this medical school, and ACT, are managing to claim that as a cost saving that they have negotiated. So it's seen as a win for everyone, really, I guess.
Well,
But maybe not the taxpayer.
yeah, maybe not the taxpayer, but particularly Stephen Joyce in this regard. And hey, at the end of the day, Waikato University, yes, they're making a bigger investment, but they're the ones that are going to gain, both in terms of extra students, an extra medical school, extra fees that they'll be able to demand there, but also where they sit on the university rankings, their prestige as a university, both in New Zealand and globally, that's just gone up. And there's a value to that, of course. That's something that they've been keen to advance.
Look, I think this is a classic case of kind of empire building by Waikato University. They want to have more prestige, be a bigger university, and you can understand that.
Yep.
And they do make some good cases for the med school. It's going to be one that's very much focused on training rural doctors.
Yeah.
And they're going to do things a bit differently to Otago and Auckland. They're going to have a different model. And in New Zealand, we do have a problem, perhaps, that some of our doctors are much more urban orientated,
Yeah.
and it's in the rural and provincial areas that we're really lacking the doctors. So that's their kind of argument for it. I mean, whether that is enough to spend an incredibly much bigger budget
Yeah.
on this, I don't think so. But
And honestly, I think these
worth
were
to see.
tweaks that were made to get this one over the line. And part of the challenges of this, once you've got your degree, once you've got your doctorate, where you practice. I mean, unless we've got people bonded and locked into rural practice only, of course, people will go where the money is.
Look, that's absolutely the case. And regardless of whether this is the right or wrong option, it's kind of a bit of a drop in the bucket because the problem is much bigger. I think the Waikato option is going to end up with about 100, maybe 120 extra doctors a year after maybe 10 years from now on. And the problem is so much bigger than that. We kind of, I think, probably still need Otago and Auckland to expand. We need a rethink on how we get our health professionals, because it really is something of a crisis. And if anything, we should just be careful that the government isn't allowed to just claim that this problem is now over.
Yeah.
They've dealt with it, because the health system still needs so much more fixing, especially in terms of getting more professionals.
Hey, I appreciate your insight and perspective on this, Bryce. Thanks so much for joining us.
Thanks, Andrew.
Hey, thanks very much for joining us in the Rhema studio. Thanks very much for watching the interview. It's kind of nice to have an audience, actually. And if you did like what you watched, then do give us a like, do give us the thumbs up. And if you'd like to see more interviews like that one, or perhaps even better, subscribe and those interviews will come straight to you. Don't forget to turn on your notifications, and we'll see you in the next one. Cheers.